It's Conduit News Radio with Paul Harrell.
All right, ladies and gentlemen, welcome back to the program. Thanks so much for being with us. We have in studio State Representative Dan Sullivan. Dan, welcome, sir.
Good morning, Paul. Always good to be here.
Yeah, so we're covering primaries across the state between Republicans. Obviously, we've been covering Jan Morgan, Asa Hutchinson. We talked about Brian King and Bob Ballinger yesterday. We also talked about you, State Representative Dan Sullivan, being primaried by a local doctor. His name's Cole Peck. You guys had a debate on Saturday. How do you think that went? How'd that go?
Well, I enjoy the opportunity to talk about what my record is. I've got a very strong conservative voting record. As you know, one of the most conservative in the state, as identified by groups like Americans for Prosperity, Conduit, the Arkansas Family Council.
Yes.
So I've got a very strong voting record there, and it was an opportunity for me to share what that voting record is and how it works for the people of Arkansas.
So you mentioned Arkansas Family Council. They have a voter's guide survey that was printed recently. Have you seen that?
I do. I have, and again, just appreciate what the Family Council stands for and the values they share.
Interestingly, one of the biggest differences between you and your opponent on the Family Council was you did not vote for the tort reform amendment that we're all going to be voting on.
That's correct.
Family Council opposed the tort reform that we're all going to be voted on because of the sanctity of life. And not only that, I saw where the director of the Arkansas Right to Life, Rose Mims, on social media, I believe, came out last week and was opposed to this tort reform amendment.
You know, I'm not going to speak for Rose, but
no, I mean I'm just saying it's a fact.
It's a fact. Well, I'm glad to hear that.
Yeah, there's a lot of people that have come out and publicly now and are saying, hey, no, this is not a good thing.
You know, and Paul, I think when I know the Doctors Association has already committed to $250,000 to oppose this. I'm guessing the Hospital Association will.
You mean to be for it?
To be for the bill.
The tort reform. Yeah.
Keep an eye on me.
No, I understand. But they want it because it's a way to protect their healthcare industry from having to pay out in lawsuits.
Yes.
I mean, that's what it's about.
Correct. And when it comes, you're going to hear a lot of different arguments about jobs and about all this, but to me, it comes down to a right to life issue. Just, I guess, as Rose Mims has said, it's a right to life issue. And also, you know, the other part of this is to restrict what lawyers can make. And I'm not going to restrict anybody's salary. I don't want to restrict doctors' salary. Mm-hmm. You know, obviously, if we want to reduce the cost of health care, because the health care issue is not an access issue, it's not an insurance issue, it's a cost issue. And as those costs continue to escalate, I guess for some people, the easiest way to do that, to resolve that issue, is to limit the cost how much we pay for doctors and how much we pay for healthcare employees. So, you know, one of the first things we could do would be to limit the amount of money doctors can make in the healthcare field. I don't support that.
So your opponent in the debate the other, I guess on Saturday, Cole Peck, he did come out, you know, in favor of the status quo when it comes to Arkansas Works, Obamacare, private option, whatever they want to call it. We've now been talking about the need to gradually draw this down to cap enrollment. I know you've been wanting to end enrollment, as you know, also still get the 70-30 match, move in traditional Medicaid, quit giving all these insurance companies, you know, billions of dollars. But he said something, and we played it yesterday, but I thought it was interesting where he said that the Arkansas Works, we have to have it, or he talked about how we've got to avoid a single-payer system. And I stopped and I said, Arkansas Works and Medicaid expansion is under Obamacare. That was about pushing us towards a single-payer system.
Absolutely. That was the goal. That was the ultimate goal, was to blow the system up. And, you know, when we first passed Arkansas Works, the private option, people said we have to make a lemonade out of lemons.
Yeah.
And I think everybody understood that concept. We've all been caught in a position where we have no good choice. So what do we do now? But that was back in, 2012 or 13?
Mm-hmm.
Yeah, we've proven that doesn't work. We weren't able to make lemonade. This is still a really bad deal. There's a sour taste in our mouth. Mm-hmm. The abuses, I heard you talking about all the abuses and cost overruns in the software that we have, all the other issues that we're having, it is, in fact, the largest expansion of a government in our nation and our state's history. And we cannot manage the people, nor can we manage the money. The solution is in reducing the size of government, including health care.
So when it talks about, in this family council survey that I have, what specific legislation would you enact? One of the things that you say, I'm going to read your statement in the Family Council survey. You say, returning authority to the people and communities. A, improving access to medical care via advanced practice nurses and telehealth. Now, that's one of your bills that you tried to get out in advance last time.
Two bills.
Two bills. And, of course, the Medical Society viciously opposed it, and yada, yada, yada. Now you have a opponent supported by healthcare industry.
Yeah.
That's not a coincidence.
Let me personalize that, Paul. What that means is if you, when this recent flu epidemic happened, that you could call your doctor from your phone sitting at home. And if it met the criteria, your doctor could treat you over the phone. So, and what that means in real time is maybe a $40 charge for that service versus going into your doctor for an office visit and having a $100 plus office visit charge. So the cost in many companies, if you had company insurance, are waiving the deductible if you use telehealth because it's so much cheaper.
Yeah.
And
which would mean that they're not it would mean that they're not able to bill the government in some cases for more money. They'd be able to bill them for less money, and and that would save taxpayer money. And the doctors are against saving taxpayer money. You are looking out for the taxpayer. The doctors are looking out for themselves. And now your opponent's a doctor, or now your opponent. You know, he is a doctor, and now he's running.
Everybody understands where you're going there,
Yeah, okay. I'm just making sure. Everybody understands the special interest here is at war.
Yeah, and the same thing is true of advanced practice nurses. You know, we had a large business in Northeast Arkansas who offered, and they're nationwide, and they tried to open a clinic under this advanced practice nurse model that they do nationwide, and they couldn't open it in Arkansas, and they were going to offer free health care to every employee and every family member, and they're prevented from doing that in the state of Arkansas. Now they've opened up a clinic limited to what is allowed in Arkansas. But now, can you imagine opening the opportunity for more industries to open a healthcare clinic in their business for advanced practice nurses to practice at the full scope of their licensure?
Just like other states.
Just like many other states. But the healthcare lobby, and of course the healthcare lobby is one of the most powerful lobbies in the state. If you go against them, you're going to end up with a well-funded
primary opponent.
There you go.
That's exactly right. All right, well, so let's look at what your opponent says he wants to do in this family council survey. An example of some of the legislation that I want to work on and enact, and this is Colpeck saying this, bring down the cost of health care for all people, especially for the person that goes to work every day to provide for their family. How does giving billions of dollars to insurance companies who are going to put PBMs and put pharmacies out of business, how does Support of Arkansas Works do that? I mean, if you look at the survey, after 2013 and us doing all this, we're now declining in health care achievement according to polls or surveys.
Well, we've actually stayed stagnant. We were 48th and we're still 48th.
Oh, okay. Sorry. Yeah, we're 48th. Yeah. Let's see. And then you get down here to, common sense regulatory reform that would allow businesses and institutions like schools to flourish. I mean, common sense regulatory reform, you were just talking about that. If you were to get the regulations away from advanced practice nurses and letting them practice the full scope, but he's against that, right?
Well, yeah, true. And Arkansas is one of the most regulated states in the nation. And, we need to do this not just in the medical side, but in all areas. I think we even have another task force looking at all of this to try to reduce regulation. It's easy to make these statements about platitudes. We need to help everybody. We need to be better. But, when it comes right down to making the changes and advocating for changes that do this, I've got a very strong record of doing that.
Let's see here. Number 5, he wrote, your opponent, that he wants to prevent legislators from introducing bills that directly benefit them financially.
I think I agree with that, because we would not let any of our doctors vote on Arkansas Works, or any of their wives vote on Arkansas Works, or anybody in the healthcare industry. Brian King finally has an ally.
That's true.
Brian, and I shouldn't. Let me rephrase my statement.
You're being very sarcastic.
And I need to stop that.
Yeah.
I think there's a level, you have to understand how Arkansas legislature works. It's not about, we have a working legislature. All of us have jobs. And to bring your expertise into the field where you work legislatively is absolutely a good thing. What we need is honesty, integrity, transparency, which is what Brian King's bill
was trying to do several times.
Tried to do. And I don't know that he has any support from the medical field.
Yeah.
The other thing, just again to demonstrate the naivete there, if we couldn't pass any bills that benefit us financially, we couldn't pass a tax cut. Now, let that sink in, folks.
Yeah.
And I don't think that's what my opponent intended.
No, I think he's
well,
aware.
I don't know. Maybe he'll come on your show.
Well, I actually, yesterday as I was talking about him, I didn't have. I've only been able to call his clinic, and I didn't have his number. And I had multiple people, when I said I didn't have his number, multiple people text me his number all of a sudden. So I sent him a text yesterday, told him he's welcome to come on. I would love to talk to him about this. I mean, I would love for him to have the opportunity to say, yeah, of course I didn't mean, that wouldn't mean a tax cut. I'm just, the public corruption that's in the headlines and everything else. But you do raise a point that if you want to prevent legislators from introducing bills that directly benefit them financially or voting on them, then he would not be able to vote for Arkansas Works because he's a physician.
Right. And again, our farmers wouldn't be able to be on the Agri Committee.
Right.
It just is a naive statement. I think another comment he makes about listening to people. Once you're in office for a few years, you have people that are frustrated with some of the votes that you have. I have a record of meeting with people, whether they agree or disagree with me, and taking the hard questions and listening to those folks and responding to it. And if we disagree, we still disagree. But it's about the debate. That's what our nation is founded on. And I think voters really need to consider, if they're going to support someone who avoids coming on your show, or who avoids coming on another show, or avoids meeting with people who disagree with them, they need to be very cautious about voting for those kinds of people.
So I watched the debate between you two. We're talking with State Representative Dan Sullivan, by the way. He's in a Republican primary. He's got one of the most conservative voting records, according to multiple scorecards, down at the legislature, and yet he has a primary opponent. Now, if you watch the debate, you and your opponent, Dr. Cole Peck, aside from the Arkansas Works issue and a few, he's against your regulatory reforms that would save taxpayer money in health care. He seems to kind of just be for a lot of the same stuff that you're for in platitudes.
Yes, because, and I made that comment several times.
Okay.
Then just when I would talk or he would talk, it's my voting record. One of them, a comment he made was, I frustrate people, particularly our superintendents. And of course, I know all those folks. And I asked them, and they said, "Yeah, you do." And I said, "Well, wait a minute, I passed." Of course, they were laughing and we were joking because we're friends. I passed or helped pass through Education Committee, which I'm on, at least 20 bills that really benefit our teachers, benefit our service people, reducing their cost going to college, helping on the health insurance for our teachers, transferring money over to health insurance for teachers. And the superintendents realized, and we, the ones that discussed it with me, 95% of the bills or more that went through there, they support. And I support it. So we disagree on a very small percentage of things, particularly about the school choice. But that's really the only source of disagreement between us and frustration. But I work very closely with our superintendents. As a matter of fact, Paul, one of the things I'm trying to do to raise our teacher pay, if people watch the newspaper I think it was last week, our State Department of Education dedicated $7 million to giving schools an A, B, C, or D. Well, by the time we sent that when we took that money out of the taxpayer's pocket, it was probably 8 to 8.5 million. We send it to Little Rock, we pass it around, and then the government redistributes that money based on a criteria that they set. So you could have a school that got 1 point higher than the threshold, they get the money back. A school that got 1 point lower than the threshold, they don't get any money. And who's to say a school that got a B deserves the money more than the school that got the C? Again, it's just government redistribution.
Yeah.
And I favored letting the taxpayer keep the money. And Paul, there are a whole lot of examples like that.
Yeah.
And
well, let me ask you this. Let's talk about school choice. It's a Republican plank in the Republican Party platform, and so Dr. Peck saying that trying to criticize you there. So does he not support school choice? Is that?
Well, I think that would be a good question for him. I think whether personally he follows that model. He may follow that model personally in a choice that he makes. My children went to public school. I taught them public school. And again, he just hasn't come out. He'll say he wants to support teachers. As a matter of fact, I asked the question in the debate, raise your hand, anybody in the audience who doesn't support our teachers. We all support our teachers. We all want our teachers to get more money. As a matter of fact, but I'm the one looking for ways to do that. Just like I want to look at ways of ending all these grants and redistribution and let the local district keep their money. He says he wants to support that, but I've got that record. I'll tell you another thing I'm looking at now, healthcare related, is we have in the healthcare side, we have taken what used to be for-profit companies in our community. They have all joined into nonprofit status. And as joining into that nonprofit status, many are no longer paying property tax. Now, it wasn't necessarily the choice that those entities made, doctors or businesses made. It was the Affordable Care Act that forced them into that. And as we continue to go down that road, we're going to continue to force people to make government bigger, which takes money out of the local economy.
Last question. We're talking with State Representative Dan Sullivan, or an observation, and I want to make this. I'll make this in the form of a question. You formerly being in the behavioral health industry, you voted against tort reform. Now, if you'd have voted for tort reform, that is something that would have directly benefited your industry financially, correct? So did you get any blowback for not being a self-serving politician for your industry? You actually voted, in my opinion, for the people of Arkansas, not your specific field.
Well, I have very, very, very few contributions from that industry now.
Okay. Okay, there we go.
But, again, that's one of the accusations that I think Mr. Peck makes in his article there, that he wants to prevent us from doing legislation that would benefit us. Tort reform certainly would have benefited the industry I was in. Arkansas Works would have benefited the industry I was in, and I voted against both of those. And the two bills that he cites in a mailer that he sent out that were self-serving passed overwhelmingly in both chambers, I think 90-2 and 88-3, because they were just bloated government and returned money to the taxpayer.
Yeah.
Everything that we do to reduce the size of government returns money to the taxpayer, and every person benefits that. So to write to the Arkansas Family Council, that you're not going to let legislation that goes through that reduces taxes for everybody is essentially what he's saying. It's just naive and not understanding about how our legislature works, the need we have for honesty, integrity, and transparency. And I think my record speaks for itself in those areas.
State Representative Dan Sullivan, I appreciate it. And again, your opponent, Cole Peck, he's welcome on the program. I've texted him. He's welcome to come on. I'd love to have a conversation with him. We appreciate you coming in.
So would you host a debate here?
Oh, absolutely.
Right.
I would host a debate here as well. Yeah. And if he had a problem with me being the moderator, I'd find somebody else to do it.
Joe could do it.
Yeah, Joe could do it, or we could honestly, I'd love to do it. I'd love to do that with all the primary candidates. I'd love to host a Jan Morgan, Asa Hutchinson debate, but that's not going to happen. All right, Dan, I appreciate it, sir.
Thank you, Paul.
Thanks so much. Folks, we got to take a break. Back in just a moment.